Hello, Mercy.
Hello, sister.
Okay. How are you?
I'm fine, thank you.
Okay. My name is Sister Grace. I'm your midwife.
The counseling will follow the gather technique and starts with greeting the patient.
From the antenatal check, it seems everything is going on okay. I now would like to speak to you about the family planning after the baby is born.
Okay, thank
Are
you,
you
sister.
okay with
Yep,
that?
that would
I'd
be very
like to
useful.
reassure you that everything we discuss here is confidential. All right. I will ask you some personal questions, including your previous medical history.
The second stage of the gather approach is to ask the patient about themselves.
Can I ask you to confirm with me your age, please?
Sister, I'm 23 years old.
Okay. And the number of children?
I have 2 children already. So I was, although I'm 23, I was married at 18.
Oh.
So my firstborn daughter is 4 years old. And then I have an 18-month-old son.
Okay.
Yeah.
And have you used any family planning methods in the past?
No, when my son was born, I relied on breastfeeding, which is what my mother-in-law had advised me to do. But then when my son was born, we tried to use condoms, but sometimes we forgot. And that's how I got pregnant this time. And I don't really want to get pregnant so soon after this time.
Oh, right. And do you have any other health problems at all?
Generally, I'm okay, but I'm a bit tired with this pregnancy.
I understand.
And I haven't really been in hospital, but I am taking iron tablets at the moment.
Have you heard about any methods of family planning which you could be interested in?
Yeah, I went to the antenatal classes and they did a talk about different methods, and I had about 2.
Yes.
The first one was about something that you can put in the womb after the baby is born. And then there was another one, they said that you can put it in your arm and it lasts for about 3 years. I think they both sounded quite interesting, yeah.
Okay.
The third stage in the gather approach is to tell the patient about the appropriate methods of family planning available to her.
I can show you, I can explain more about the methods.
Okay, that would be helpful.
Okay. This is what the IUCD looks like.
Okay.
This is what is put inside the womb. And it can last a long time, up to 12 years. But obviously, if there are any problems or if you want another baby, then it can easily be removed and you are able to have your baby immediately.
Okay.
The first checkup will be at 6 weeks.
Okay.
Or unless if there are any problems.
Okay.
And then the other one, which you also describe, is the implant. The implanon.
Okay.
Yeah. It also is a small plastic device which has got hormones on the inside,
Okay.
which is introduced just under the skin.
Okay.
It is not, you can feel it, but it is not visible to anybody. You can still wear your dresses and t-shirts without any problems.
Okay.
But it can stay in there for up to 3 years and will be also taken out if you now want to have another baby or you have any problems with it.
Okay.
Master, there are a few other methods of family planning. Would you be interested in me telling you about them?
What kind of methods are those? Which other ones are
The
they?
pills and the injection.
Oh, no. I'm going to forget to take the pill. No.
Okay. Are you going to breastfeed your baby?
Yes, I am.
Okay. And have you discussed the family planning with your husband?
I have, but he's happy for me to take care of it. He says it's the women's business, so he's quite happy for me to talk to you about this.
Okay.
The fourth part of the gather approach is to help the patient to choose a method. Ask her which method she'd like to use.
Of the 2 methods we talked about, have you decided which one you would like to use?
I think I'd like to have the one that you put in the womb, the one you call the IUCD.
Yes.
I'd like to have that one. But the thing is, you mentioned that it lasts up to 12 years. But I may decide to have a child before, like around 5 years' time. Would that be able, what will happen then if I want it removed?
That's not a problem. As I mentioned that when you have decided you would like to have another baby, we just come back into clinic, and it's a very small procedure to remove it. We'll remove it, and you can, as soon as you would like, start planning to have your baby.
Okay, thank you.
Mercy, so you've decided you would like to have the IUCD?
Yes, sister.
So I'll make a note in your notes so that when you come for delivery, the midwives will have everything in place and it will be done.
Okay. Once the patient has chosen a method, the fifth part of the gather approach is to explain how to use the method.
I'll just give you a little detail about what will happen at the time of your delivery. When the baby has come out and the afterbirth has come out, the placenta, then it will take a minute or two to just pop this into the womb again. It's easy because the womb will still be open after the baby has come out. And it's not usually supposed to cause any problems. The only time we may not be able to put the IUCD in is if there's any sign of infection or if your membranes, if your waters were broken for a very long time, then we may have to use another method. We may have to do something else at that point.
Okay.
Yeah.
Okay.
Do you have any questions?
Not really. You've explained it really well, sister.
Okay.
The final stage of the gather approach is to explain to the patient that she will be offered a return visit for follow-up, and that she can return if she has any problems or concerns about the family planning method chosen.
Mercy, it is recommended that you come back for checkup at 6 weeks, which will be at the same time as when you are coming for the checkup for the baby. We will check and make sure everything is okay, you're still happy with continuing with the IUCD, and we can also check and see it is still there, because occasionally it can fall out. And if it falls out, it means you are no longer protected and you could conceive another baby.
Okay. So I should come back if I see it falling out, yeah?
If it falls out, yes, you have to come back as soon as possible.
Okay.
Okay, that's fine. Do you have any other questions?
Not really, sister. I think you've explained it very well. Thank you.
All right. Thank you for your visit, Master. This is the leaflet which has more information in case you would like to read about it at home.
Thank you very much, sister.
Thank you for your visit.
Thank you.
Bye-bye.
Bye. In summary, family planning counseling can follow the 6 steps of gather: greet, ask, tell, help, explain, and return.